Next is about athata Nayana abhighat pratishedam vyakhyasyaamahe hetuvacha abhivandanantarihi, about the trauma to the eyes and the complications to be handled. अभ्याहते तु नयने बहुधा नराणां संरम्भराग तुमुलासु रजासु धीमान् नस्य आस्यलेप परिशेचन तर्पणाद्यम् उक्तं पुनक्षसज पित्तजशूलपथ्यं दृष्टिप्रसादजनां विधिमाशु कुर्यात् स्निग्धैः हिमेश्च मधुरैश्च सदा प्रयोगैः. In case of the trauma to the eyes, which can present with the either pain, reddish discoloration or discomfort to the patient, treatment protocol could be either nasya or mukhalepa or parishechana or tarpana etc., which are useful in the treatment of raktaja and pittaja vyadhi, and any of those protocols which can improve the vision as such, shita virya dravyas, madhura rasa dravyas are to be used in general. Sweda agni dhuma bhaya shoka rujabhigatihi abhyahatam tathaiva bhishak chikitseta. Similarly, as in case of the trauma, the eyes also could be affected due to either the fumes around, or it could be the fire, the smoke, or psychological abnormalities like fear or the sorrow, or any other pain also can produce the damage to the vision, and there too it is the same line of treatment: pittahara, shitavirya, madhura rasa dravyas. सद्योहते नयने विष एष विधिहित तदूर्ध्वं संदेहितो भवति दोषम् अपेक्ष्य कार्यः. If the patient comes immediately after the injury, it should be pittahara shitavirya krama. But if the patient comes later, once the inflammatory process has started, then the treatment will be the same protocol as that of the abhishanda, conjunctivitis like treatment, inflammatory pathology, depending upon the dosha lakshanas, whether it is a pittaja or kapaja or vataja lakshanas. Similarly, the drugs have to be selected and the treatment has to be done. Abhyahatam nayanam misha atha asya bashpa samsvedinam bhavati tannirajam kshanena. A minimal injury, some superficial injury to the eyes, can be managed with the simple bashpa sweda at that moment, which can reduce the pain immediately. So it's not true for the deeper injuries. Superficial injuries, minimal injuries, they can be managed with the fomentation. Sadhyam kshatam patalamekam ubhetu krichhe trini kshatani patalani vivarjetu. Syat pichitam cha nayanam ehe ati chavasannam srastam chutam cha hatadrik bhavetu payapyam vistirna dristihi tanuragam asat pradarshi sadhyam yathastvidam anavila darshanam. Now, if the injury is deeper, if the injury has involved only either the first and the second layer of the patalas, the drishti patala, it can be managed. But if it has gone deeper beyond the three patalas, then it becomes asadhya, it cannot be saved. Or if the eyeball, ocular ball has become affected, it has become compressed, pichila, or if it has become depressed as such, or if it has become ruptured, or if it has become displaced from the side, or if the vision is completely lost, in such conditions it cannot be cured, but it can be apya. That's the complications can be somewhat reduced, but he cannot be able to see that our object cannot be cured as such. And ultimately, what is the deciding factor is whether the patient's vision is preserved or not. If the patient is able to see even with the injuries, to a certain extent it can be managed, whereas if the patient is not able to see the objects or his vision is completely impaired, in such conditions it cannot be managed as such. Pranoparodha vamana kshudakantarodhihi unnamyam ashu nayanam yada ati prabhishtam. If the eyeball has become displaced from the orbit cavity, if the patient is conscious, and if you can give the vamana or the other protocols, if the patient is fit for that, then the eyeball can be pushed back and it can be replaced. Netre vilambini vidhi vihita purastat uchinganam shirasi vari avasechanam cha. If the eyeball is just hanging out, again it can be displaced, and the patient has to give a nasya and cold bath over the head, which can help in recovery. षट्सप्ततिः नयनजाय इमे प्रदिष्टाः रोगाः भवन्ति अमहतां महतां तिरेभ्यः स्तन्यप्रकोप कफमारुतपित्तरक्तैः बालाक्षिवत्मभव एव कुकूणको अन्यः. Now the 76 disorders are mentioned in the earlier condition. Along with that, one more is the kukunaka. That's in the children when there is a continuous discharge from the eyes, which can be produced due to abnormalities of the breast milk or due to visheshan of the kapha, vata or pitta doshas. Such a condition which involves the palpebrae of the child is called as kukunaka. It's a sort of blepharitis produced in children. The signs of that kukunaka is मृद्नाति नेत्रम अधिकंडुम अथाक्षिकूटम नासाललाटमपि तेन शिशुस्स नित्यम सूर्यप्रभां न सहते स्रवति प्रबद्धम तस्य आहरेत रुधिरम आशु विनिर्लिखेच्च क्षौद्रायुतैश्च कटुभिः प्रतिसारयेत् मातुः शिशोः अभीतं च विधिं विदध्यात्. In such conditions, the patient would be having itching over the area or itching over the forehead also, or even the nose, and the child would not be able to see the bright light. In such conditions, Sushruta suggests about Raktamokshana and Lekhana karma, and the pratisarana of the eyeball with the Kshaudra Katudravya with the Kshaudra honey, as well as the medicines can be given to the mother. Of course, a neonatal conjunctivitis is one of the common issues, and most of the times it could be due to the contamination occurring during the delivery, and the usual protocol is cleaning the eye with the simple saline or rarely with some antibiotic solution, which is practiced now regularly. Eye drops of saline is regularly used in congenital pediatric practice in the newborn. तम वामयत्तु मधुसहितव संप्रयुक्तैः पीतं पयः खलु फलैः खरमञ्जरीणां स्यात् पिप्पली लवण माक्षिक संयुतैर्वा नयनं वमन्तमपि वामयितुं यतेत. Now, the vamana can be given either to the neonatal child or it could be to the mother. The vamana has to be given with the madhu saindava samprayukta, madhu and saindava lavana, as well as the kharamanjari, that's apamarga phala bijas, or pippali or lavana makshika sanyutai. Lavana also can be added, pippali can be added to that vamana dravya. And even if the child is not ready to vomit, like, you have to attempt for the vomiting. Dattva vacham ashana duddha bhuje prayajyam urdhvam tata phalayidam vamanam vijijnehi. Another of the option for vamana is giving vacha with milk, and vamana phala can be given later. Jambu amra dhatri anudalaihi paridhavanartam karyam kashayam avasechanevo api. For cleaning of the eyes, kashaya, apu, jambu, amra, dhatri, these can be used for cleaning of the eyes in kukunaka or neonatal conjunctivitis. Aschotane cha hitam atra ghrisam guduchi siddham tatahurapi cha tripala vipakvam. Aschotana can be done with the guduchi ghriza or tripala vipakvam. Tripala ghriza also can be used. Nepalaja maricha shankha rasanjanani Sindhu prasuta gura makshika sanyutani syadanjanam madhurasa madhuka amraka irva krishna yasam gritapayo madhu apidagdham. Anjana also can be done with the Shilajito, Maricha, Shankha, Rasanjana or Saindhavalavana, Guda, Makshika. With this Anjana can be prepared, or any other Madhura Rasa, Dravya or Madhuka, Amraka, then this iron, pig iron, Grita, milk and Madhu also can be used for this Anjana preparation. Vyosham, Palandu, Madhukam, Lavanottamam cha Laksham, Gairikaritam, Gutikanjanam va Nimbachadam, Madhuka Darvi, Sadam Lodhram, Icchanti Chatra Bishajo, Anjanam Amshatulyam. Another of the anjana which could be done with the trikatu, palandu, onion, and madhuka, one of the main Sandalavana, Laksha, Gairika, and Tikanjana, and the barks of the nimba tree, and Tamra, Lodra also can be added to this, and that anjana is suggested. Srotoja, Shankha, Dali, Saindavam, Arthapaksham, Shukram, Shishoh, Nudati, Bhavidam, Anjanena, Sende, Kafad, Abhighat, Kramam, Acharecha, Balasya Roga, Kushalo, Akshikadam, Dighamsuho. For the neonatal conjunctivitis or other diseases of the children, the preparation of the anjana with the Shilajitu, Shankha, Dadhi, Saindava, these and these can be used for the anjana. Samudra iva gambhiram naiva shakyam chikitsidam vaktum niravasheshena shlokanam ayuterapi sahasrirapi bhaproktam artham alpamatirnaraha tarka grantha artharahitaha naiva grunati apanditaha. Now the possibility of the varieties of injuries to the eyes could be very innumerable, and Sushruta compares it to the depth of the sea. Samudraiva gambhiram, the complications which can be produced due to the injury to the eyes is innumerable, and it's so deep that it cannot be expressed with either 1 crore shlokas or 1,000 shlokas or so on. And those who are intelligent, they have to condition to the situation, assess the situation and plan the management. If you do not have that logic and if you do not have the knowledge of the text, then you cannot perceive the situation at all. Tadidam bahugudhartam chikitsa bijamiritam kushalena abhimannam tad bahuda abhipravohati tasmat matimata nityam nana shastrartha darshina sarvam ushyam agadhartam shastram agama buddhina. So hence all that whatever is described in these 12 chapters is only as a chikitsa bija, just a seed like, or a comprehensive formula, or a capsule knowledge, and hence a skilled surgeon or skilled physician should develop these based upon these texts and based upon the skill and experience, and then only you can enhance. So that basic textual knowledge is a basic knowledge, and based upon that the issue knowledge has to be developed. Now, as far as the ocular injuries are concerned in the contemporary situation, if you go into the ophthalmology issues, the ocular injuries could be categorized as mechanical injuries, chemical injuries, thermal injuries, radiation and ultraviolet light injuries. Mechanical injuries could be any mechanical injury, which could be again superficial scratches or blunt trauma where there could be hemorrhage into the eyes, or penetrating trauma where the structure of the eyeball could be penetrated. Presence of the foreign bodies is one more of the complications of the trauma. Chemical injuries like acid burns or any other chemicals which can accidentally or any times homicidal or this exposure can occur. In industrial situations also chemical injuries can occur. Thermal injuries where the heat directly, as again in industrial conditions or domestic conditions, burns could occur. Either it could be a humid burn like hot water, or it could be dry burn like the flames which can produce damage to the eyes. And in the heat burns, the damage would be always much more extensive than what you can really see. Clinical assessment would be quite difficult. Then radiation and ultraviolet injuries also are now becoming more common now. Of course, in addition to that, one more which can be included with, though it's not categorized as injuries, complications into the eye would be due to the screen or use of bright screens like computers and mobiles and so on. From the clinical assessment point of view, the injuries like a black eye is a presence of subcutaneous hemorrhage around the eyeball, which could be a sign of trauma elsewhere over the skull. There could be a black presentation around the eyes and swelling around the eyes, which in such conditions really the trauma may not be over the eye, it could be somewhere over the scalp area, and because the orbital area is having a loose areolar tissue, blood tends to get accumulated. So a patient presenting with a black eye, your attention would be more towards the other areas to identify the location of injury than really the eye. And there is virtually no need of a specific treatment for the eye in such conditions, but that primary injury has to be located and suitable treatment has to be followed. Subconjunctival hemorrhage is again a very common minimal injury condition, and in which situation spontaneous recovery could be possible. You need not go into any energetic treatment. All that what you have to do, ensure is there is no other deeper injury, and wait for a few days, the subconjunctival hemorrhage heals. Maximum you may have some soothing agents which could be poured into the eyes. But if the injury is into the ocular chamber, it can produce the presence of that blood seen as such, which can impair the vision, which is also called as hypena, which needs more elaborate treatment. A simple general practice treatment would not be enough. You have to decide whether the patient may require surgical drainage or not based upon the quantity of the bleeding. If the bleeding is more than half, then a surgical treatment may be necessary, and the surgery also is very skilled surgery, not a very easy surgery. Or otherwise, in a minimal injury, a simple management with the antibiotics and Beijing also could be enough. Then eyeball rupture, the globe rupture, is one of the very serious complicated condition which may not be possible to be managed with your routine clinical practice. The patients with the orbital fracture, again very complicated conditions where the possibility of multiple injuries could occur, and the treatment also would be very complicated. A multidisciplinary approach may be required in such conditions. So to go into the details of that would not be possible now. Then another complication is the foreign body in the eye. To identify the foreign body in the eye as well as techniques to remove, there are lots of techniques used now. Instruments like magnets are used in the industrial situations, or depending upon the type of the foreign body as well as size of the foreign body and the location, the planning has to be elaborate as such. That's about in brief about the injuries to the eyes. So details, of course, there is no end to the details. With this, we conclude the diseases of the eyes. इति सुश्रुतसंहितायाम् उत्तरतन्त्रे शालाक्यतन्त्रे नयनाभिघात चिकित्सितं नाम एकोनविंशोऽध्यायः. These 21 chapters dedicated to eye injuries are completed. Next we will start with the कर्णरोग चिकित्सा, कर्णरोग प्रतिषेध, which we will start in the next session. So today we will conclude. If there are any questions, okay, no questions. So we will conclude today bit early because the chapter is smaller. In the next we will start with the Karna Roga. Okay, right.